How do genetic markers change lymphoma prognosis and treatment? Imagine a tiny change in your DNA could influence how your lymphoma behaves and how well treatments might work. That's the power of genetic markers in understanding and managing lymphoma, especially non-Hodgkin lymphoma. These markers are specific mutations or alterations in genes that control how cells grow and survive. By identifying these changes, doctors can classify lymphoma more precisely, predict its course, and choose the best treatment options. Genetic markers play a big role in prognosis, which is about understanding what might happen with the disease over time. For example, in diffuse large B-cell lymphoma, the most common type of non-Hodgkin lymphoma, certain genetic features can signal a higher risk of treatment failure or relapse. Mutations in genes like CDKN2A and PIM1 have been linked to poorer survival outcomes. When doctors combine genetic information with traditional tools like the International Prognostic Index, they can better estimate a patient's risk level. If a patient's genetic profile shows high-risk markers, they might need closer monitoring or more aggressive treatment to improve their chances. Other genes, such as TP53, are also important. Mutations in TP53 are associated with worse outcomes across many lymphoma types, including follicular lymphoma. On the other hand, some gene expression patterns, like high levels of BCL6, can be linked to better prognosis. So, genetic markers help paint a clearer picture of how the disease might progress. When it comes to treatment, genetic markers are guiding more personalized approaches. For instance, in follicular lymphoma, mutations in the EDGE2 gene can predict how well a patient might respond to targeted therapies like EDGE2 inhibitors. Patients with these mutations tend to respond better to such drugs. Additionally, some risk scores combine genetic and clinical data to help decide whether a patient should receive standard therapy or a more intensive approach. The M7-FLIPI score, for example, looks at 7 gene mutations along with clinical factors to identify those at higher risk of treatment failure. In clinical practice, genetic testing is becoming more common. It helps doctors classify lymphoma into specific subtypes, identify patients who might relapse, and select treatments that are more likely to be effective based on the tumor's genetic makeup. This approach can also prevent unnecessary treatments, reducing side effects and costs. But it's important to remember that genetic information is just one piece of the puzzle. Factors like disease stage, patient age, overall health, and how the disease responds initially are also crucial in guiding treatment decisions. Research into genetic markers is ongoing, with scientists working to discover new targets and improve risk prediction models. As our understanding deepens, genetic testing is expected to become even more integrated into lymphoma care. Still, not all tests are available everywhere, and they should always be used alongside other clinical information. Remember, every patient is unique, and treatment plans should always be personalized through consultation with healthcare professionals. In summary, genetic markers are transforming how we understand, predict, and treat non-Hodgkin lymphoma by enabling more precise diagnosis and tailored therapies. This progress marks a significant step toward personalized cancer care, but it's essential to combine genetic insights with comprehensive medical evaluation for the best outcomes.